Morning, everyone. Thank you very, very much. Well, good morning, good afternoon, or good evening, everyone, depending on where you're joining us from. Thank you very much for signing on to our GANSID Congress. My name is Chloe. I am with the Taskov Consulting Group, and it is my pleasure to welcome everybody here. I would first like to quickly turn it off to Dr. Edekele to go through the moderators' rules.
Oh, okay. Well, let me join Chloe and the organizers in welcoming everybody to this Congress. I hope you have all received the emails detailing the processes for the Congress and the operations. All the sessions have moderators whose role it is to handle the proceedings of each session. And for the participants, you are welcome to participate as much as possible. There are several ways of doing that. You can, if you have questions, please put them either in the chat box or in the Q&A box. There might also be a chance for you to ask questions orally, so you can raise your hand, and if there's time, the moderator will take the decision on, how many people can be given the opportunity to do that. Okay. And at the end of each session, there would be a poll, and we urge that everybody participates. That would help the organizers to have a good idea of the reception of each of these sessions, and would help in planning future congresses. So I wish everybody a very fruitful and enjoyable Congress. Thank you.
Thank you very much, Dr. Edekele. And now it's my pleasure to welcome our CEO of GANSID to deliver the welcome address in GANSID in Review. Lanre Tunji Ajayi is a global patient advocate in sickle cell disease and other inherited blood disorders with decades of experience in patient engagement and program development. She co-founded the Global Alliance of Sickle Cell Disease Organization, or GASDO, and as well as the Global Action Network for Sickle Cell and Other Inherited Blood Disorders, or GANSID. She was also a past chair of the Network for Red Blood Disorders and co-founder of Ontario Hemoglobinopathy Patient Association. As the co-founder of SCAGO and also the Sickle Cell Disease Association of Canada, she has significantly raised the visibility of sickle cell disease in Canada. Her efforts include advocating for newborn screening across the country, getting World Sickle Cell Day enacted at the national and provincial levels, and influencing policies to improve health outcomes of people with sickle cell disease. She has been recognized for her leadership with several prestigious awards. Please help me welcome Ms. Lanre Tunji Ajayi.
Thank you. Thank you very much, Chloe, and thank you also, Dr. Edekele, for the warm welcome. Again, good morning, afternoon, evening, and night, depending on where you are joining us from. It gives me much pleasure to welcome you to the second annual Congress of the Global Action Network for Sickle Cell and Other Inherited Blood Disorders. You and I will be together today and tomorrow, and I think that's very exciting. As you know, this year's Congress theme is Advancing Access to Therapies in Inherited Blood Disorders. And we have put together a lineup of impressive panel of world-renowned speakers to deliver the Congress topics. These topics include development in gene therapies and stem cell transplantation, accessing, modifying, and curative therapy. We have topics targeting hemophilia, thalassemia, sickle cell, and other inherited blood disorders, capacity building for patient organizations, and many other knowledge impacting topics. This Congress has different learning tracks to support the education of healthcare providers and other clinicians, patient organizations, patients and their families, community members, researchers, and industry partners with interest in inherited blood disorders. No doubt, this Congress is meant to impact everyone in the space of inherited blood disorders, and you do not want to miss any of the 2 day sessions. We have developed the program to factor the time differences across the different regions of the world, and we hope you will join the Congress in the comfort of your home or workspace or any other location of your preference to co-learn along with hundreds of other attendees. We encourage you to keep the Congress agenda close by yourself and ensure that you convert the Eastern Standard Time on the program to your local time to ensure you are able to join every session on a timely basis. This Congress promises to provide a forum for exchange of ideas and to leverage the advances made in some of the inherited blood disorders for the benefit of the wider community of these underserved and neglected diseases. This Congress will focus on equitable access to therapies regardless of where people with inherited blood disorders live in the world, whether in low, medium, or high resource regions of the world. There will also be an industry alliance symposium bringing the industry, healthcare providers, and patients together in a candid discussion of how we could build an interconnected alliance in inherited blood disorders. This session is a must attend for every Congress attendee. On this note, I would like to thank our speakers, moderators, and the attendees of the Congress 2024. Without you making the time to be here, there will not be a Congress 2024. I would also like to thank our gold level sponsor, Pfizer Inc., our silver level sponsors, Agios Inverted Pharmaceuticals, and the other sponsor, Roche. I would also like to appreciate Pascop Global Consulting for supporting the planning of the Congress 2024. Without taking much more of your time, I want to thank you again for being here with us over the next 2 days and wish you a most impactful and enjoyable Congress 2024. However, before we move to the session, we would like to provide you with an update on GANSID on some of what we have been able to achieve to date. And I will share my screen in this effect. So what is GANSID? GANSID was incorporated on January 18, 2022 in Delaware, USA. However, this organization did not start operations until 2023. We purposely took a whole year to consult with different stakeholders in the space of inherited blood disorders because we recognize that many organizations and individuals are working in this space, and it's very important to meet with them to better understand what are the gaps and how can GANSID support the work that they do. That took us a whole year to get through the consultations with various stakeholders, and some of you on this call today were part of those consultations. The GANSID is a global network of patient organizations, healthcare providers, health organizations, researchers, professional and academic societies, and industry partners that serve people impacted by sickle cell disease and other inherited blood disorders. GANSID's mission is very simple. Is to identify common purposes among inherited blood disorders in order to embark on cross-disease advocacy while lending our voice to disease-specific initiatives. All this we're doing in order to meet the needs of people living with inherited blood disorders, no matter where they live in the world. The GANSID is bringing the voices of inherited blood disorders together to advance care, treatment, research, capacity building, and education, especially in regions of the world facing acute challenges due to underdeveloped healthcare systems, poverty, and a lack of disease awareness. With this year's Congress theme, From Awareness to Action Transforming Lives, the GANSID is emphasizing the need for tangible steps to improve the lives of those affected by inherited blood disorders. Our board of directors are across different regions of the world, from the Middle East to North America to Western Pacific region to Africa to Latin America to Southeast Asia. We have representation as clinicians and people with lived disease experience, as well as government officials. In 1 year of operation, GANSID is able to have joined its efforts 70 plus patient organizations across 30 countries, and you can see the map that shows where we currently have member organizations. 1 year in review, we thought you would like to know what has GANSID been able to do. So our goal areas fall under, 5 main areas, which is advocacy, research, care and treatment, awareness and outreach, and advancement through collaboration. We also support, of course, capacity building of healthcare providers and patient organizations. In the area of advocacy and in our efforts to increasingly improve awareness around inherited blood disorders, we encourage member organizations to start to work in their various countries in advancing the enactment of Inherited Blood Disorders Day. We are very pleased to report that Canada has introduced Bill S-288 to recognize Inherited Blood Disorders Day, and we hope other countries will continue to make impact in this area. Also, in the area of advocacy, we were able to support an hospital in the States and also a few in Canada in working towards getting funding for comprehensive care sites. In the area of research, we all know that it could be daunting for those who might not be very familiar with clinicaltrials.gov to access available clinical trials in their own diseases. It could be patients, it could be sometimes clinicians, especially those who are practicing in low, medium resource countries. So GANSID has started the process of compiling all the clinical trials that are in inherited blood disorders from clinicaltrials.gov, and we are hoping to lay it on our website in a format that will be easier for people to really, access. And we hope to get that compilation on our website done in first quarter of 2025. We are also aware that many of the sites or hospitals in low and medium resource countries do not necessarily always qualify for clinical trials, efforts. And mostly this is due to the fact that they do not meet the standards. As such, GANSID has established a clinical trial site standards working group that is working on developing guidelines and recommendations that will then allow more sites in low, medium resource countries to qualify for clinical trials. In our working group, we have experts who are well-versed in clinical trials matters, we have industry partners, and we have regulators on the working group. Under the care and treatment goal, our goal is to provide physicians with access to care and decision support tools through our mentorship program. In 2023 and 2024, we were able to start recruiting, and we continue to recruit seasoned hematologists to mentor up and coming hematologists. We are very proud that this program continued to grow and advance very well. We also support efforts in different countries, including India, for people to access life-saving therapies such as Desferal. We provided submissions to WHO, Desferal in clinical trials as well. We were also able to improve on our Congress 2023 this year by rather than having just one track, but now we are able to divide our Congress into various tracks to support clinician learning and patient and families learning. We also established an industry registry advisory council. We understand the importance of clinical data collection of people with inherited blood disorders, especially in low and medium resource countries. And we're hoping to advance this data collection initiative of people with inherited blood disorders, starting with sickle cell disease. In the area of awareness and outreach, GANSID was all over. We were in Bangkok for the ISTH conference. We're in Canada for the Kinhim conference. We're going to ASH. You see us at ASH in a few weeks. We attended ASCAT. We were at the Doris conference. We were all over. We developed various education materials, and we were able to distribute this to about 30 plus patient organizations to date that requested these materials. We also launched the Thyroid campaign. Many of you will see on the first slide that you notice people were tying red. Just go to that first slide quickly. Yes, to see, you can see people were tying red. We launched the Thyroid campaign again to raise awareness around inherited blood disorders, and we are very pleasantly surprised to see that thousands and thousands of people joined the campaign this year. We were also in the area of advancement through collaboration. We are able to also successfully engage with the larger inherited blood disorders community, including the hemophilia, thrombophilia, thalassemia, sickle cell, Fanconi, and aplastic anemia communities. Again, we have currently 70 plus organizations across these disease areas in 30 countries. We were also able to meet with different governments in different countries, including the Indian Minister of State for Social Justice and Empowerment, Minister Shri Ramdas G, on improving health outcomes for people with inherited blood disorders. And I'm pleased to announce that, India has disability program for people with sickle cell, thalassemia, hemophilia, and this is all due to the work of the Ministry of Social Justice and Empowerment. We are also able to align with WHO in addressing care and gaps in inherited blood disorders in low and medium resource countries. In the area of capacity building, we do understand that patient organizations mostly are doing a lot of work in their own countries, in their own disease areas, but we also recognize the fact that many of them might not have the necessary skill set to truly advance advocacy and other, work that they're doing effectively. And we were able to develop and launch this year e-course models for patient organizations. We were also able to provide laptops and website support to about 25 patient organizations serving in low resource countries. GANSID was able to develop resources, develop various toolkits to support patient organizations, and we also developed booklets on inherited blood disorders. So you can join GANSID either by being a volunteer. There's a link to do that. As a healthcare provider, we have a global forum for healthcare providers whereby they can join and be part of a global forum of other clinicians. We have regional forum that we focus on your own region, and you can meet other clinicians in that region. You can also be part of our mentorship program, and you can sign up either as a mentor or as a mentee. As a patient organization, we continue to work towards empowering patient organizations to better support families with inherited blood disorders. And you can apply for a membership. It's free as long as you serve patients in your own country. And we also have the 8-module online training that you can access in the comfort of your home, and the link is provided there. And if you are not a patient organization, you are not a healthcare provider, but you serve people with inherited blood disorders, you're part of healthcare ecosystem. You could be representing professional and academic society, blood operators, biopharmaceuticals and medical devices company. As long as you share GANSID priorities and you have interest in collaborating with our network, you can also apply. Your organization can apply as an affiliate. So basically, organizations can apply either as a member organization or an affiliate, and individuals can apply as volunteer, or they can join one of the programs that we have. And on this note, I will stop sharing, and I would like to take the time to see if there's any question on GANSID at this time. If there is no question, I'd like to use this time to welcome the chair of GANSID Board of Directors, Dr. Adekunle Adekile. Dr. Adekile holds a PhD in cell biology from the University of Maastricht, Netherlands, based on his thesis, Comparative Studies of Nigerian and Kuwait sickle cell disease patients. His research expertise is in the phenotypic variability of the disease, especially the presentation among patients with the Arab/Indian haplotype and elevated HbF, fetal hemoglobin. He was the founding chairman of the Nigerian Sickle Cell Disease Network and the Sickle Cell Support Society of Nigeria, and he has more than 160 publications in peer-reviewed journals. In 1990, he was the recipient of the Fogarty International Fellowship, which took him to the Medical College of Georgia, Augusta, USA, where he worked in Dr. Titus Hausman's laboratory and the Comprehensive Sickle Cell Center. Dr. Adekile moved to Kuwait in 1993. He is the chief of pediatric hematology at Mubarak Hospital, where he looks after patients with sickle cell, thalassemia, and other hematological disorders. He is the director of the Kuwaiti National Sickle Cell Disease Registry, which he established in 2011. He is active in the hematology professional circles in the Arabian Gulf. He has served as a consultant with WHO and AFRO on the management of sickle cell disease in Africa. He is the current editor-in-chief of Hemoglobin, the International Journal of Hemoglobin Research. I'm also very pleased to say that Dr. Adekunle Adekile recently retired, and we are very pleased to have him, in advancing the sickle cell disease cause and inherited blood disorders. Thank you very much, Dr. Adekunle. Thank you.
Okay, well, thank you so much, Larry, for the introduction. And I'm also very happy that you have given a broad overview of GANSID and its accomplishments. And I must say that it's been a great pleasure for me to serve as the chair of the board of GANSID. GANSID has such noble programs and ideas, and the vision and mission are very clear in serving the underprivileged who suffer from these inherited blood disorders. And the model of GANSID in combining several diseases and advocating for them makes a lot of sense, especially in the context of the low middle income or resource countries. I mean, even anywhere all over the world, these diseases are considered orphan diseases. So they really need advocacy. And this becomes much more important in the low and medium resource countries. And the different diseases can learn from each other. Those that are a little more advanced in advocacy, like sickle cell, hemophilia, and thalassemia. However, especially in sub-Saharan Africa, even sickle cell disease still has a long way to go in taking care of the people who live with the disease. As we know, most of the patients live in the rural areas that are underserved in terms of medical services. And that's why it's so important to have an organization like GANSID that galvanizes the different patient organizations, encourages them, supports them, and conducts educational programs to empower them. And many of the other diseases are practically completely neglected. A lot of people who have the disease do not even know. So it's time that we shine some light on these other issues. Even for patients who may have hemophilia, we have seen or heard of many families that individuals have passed on from bleeding that were never really diagnosed. The other thing, although thalassemia is so well known, however, in sub-Saharan Africa, we still have not put it in its right perspective. We really do not have a good handle. Some of us think that while in the Mediterranean or North African region, thalassemia is quite prevalent, in sub-Saharan Africa, we're not quite sure. So, and it's time that we define, the extent of the problems. We know that alpha thalassemia is very common, although it's not usually severe, but we need to have more studies in different parts of sub-Saharan Africa to define the problems. Now, there are some programs that GANSID has initiated that I want to touch on a little bit. I know that Larry has talked about them. And one is the mentoring program. I really want to commend this to young physicians, researchers, and scientists. We're not limiting it strictly to only hematologies, or people who want to have mentoring in hematology. Any physicians that are looking after any of these patients, and you, especially because I worked in Nigeria for a long time, and I know how disturbing it can be when you're by yourself and you don't have anybody to exchange ideas with, you don't have any senior person to direct you. Therefore, I would really commend this. If you apply, we look for somebody, a senior who is interested in mentoring you. You can exchange ideas in terms of career opportunities, in terms of research opportunities, and other doctors, like especially people who are interested in pain management or in the emergency care, because these are, again, the people that are the first responders, so to say, when the patients, especially sickle cell patients, present in severe pain crisis in the hospital. So we need people to be trained using the right products, especially opioids. People need to be trained, okay? The other aspect that I would want to touch on is the educational programs. There's a well-developed, and I would really commend the patient organizations to visit the GANSID website to access the e-learning modules in advocacy. Advocacy is a science and an art, and people need to be trained to maximize their efforts. So I would really commend that to patient organizations. And I'm hoping that as time goes on, we'll be able to develop more modules, especially for community health workers, who might be, looking after patients at the primary healthcare level. As you all know, the World Health Organization and the United Nations have, advocated that sickle cell disease is a public health problem and it should be dealt with at the local level. And tomorrow, I'm going to be giving a talk on the WHO guidance framework for sickle cell disease in sub-Saharan Africa. I think GANSID is in a unique position to partner with the WHO in this respect, because with the global reach and the grassroots involvement of GANSID, we can do a lot to partner with the WHO in developing capacity in documenting statistics and data. And hopefully, as time goes on, as Larry said, we're also looking at the criteria for enrollment in clinical trials. And there will be different levels of activity. So we should be able to put this in the right perspective and, hopefully bring equity to all the opportunities that are available. Now, that's all I'm going to touch on at this time. Just again, commend our CEO and the organization behind her. The professionalism, the enthusiasm, and the passion that they've demonstrated is very commendable, and with them more success. Again, let me welcome everybody to this Congress, and please participate actively and visit the GANSID website. We all need to work together. It's a partnership across board. Thank you so much.